Morning air full of dust. This is what Bangkok looked like during the past week. PM2.5 pollution is reaching dangerous levels in several areas of the capital, grossly exceeding the standard threshold of 37.5 microns and posing threats to people's health. According to a report by Thai Health Watch 2024, around 1.7 million Thais in 2023 were diagnosed with conditions resulting from air pollution, mostly respiratory diseases. Despite the fact that PM2.5 affects people's health every year, it was not until the story of a doctor, Krik Thai, who died recently after documenting his battle with lung cancer on social media that Thai society took significant notice of air pollution. This persistent problem has led to the introduction of a series of clean air bills, which set out short, medium, and long-term measures to tackle the PM2.5 pollution, aiming to bring about clean air for public safety. The bills are also aimed at developing air quality assessment, monitoring, and early warning systems, and introduces criminal and civil liabilities for violators. There are 7 drafts of the Clean Air Bill from the Cabinet, a People's Network, the PM2.5 Party, the PM2.5 Party, the Palang Pracharat Party, the Democrat Party, and the Move Forward Party. 4 of them have been considered in the House of Representatives, which are those from the Cabinet, a People's Network, the PM2.5 Party, and the PM2.5 Party. The Clean Air Bill from a People's Network proposes tools and economic incentives, which include clean air taxes and a clean air fund, the revenue for which will come from fining polluters. It also proposes that vulnerable people be entitled to free health checkups in government hospitals. Bills from the PM2.5 and PM2.5 parties aim at improving the geographic database system and identification of the sources of air pollution. They also introduce clean air officials who will have the authority to order polluters to submit related data to the Ministry of Natural Resources and Environment. The bill from the Cabinet shares some similarities with the others, such as introducing clean air officials, incentives to reduce air pollution, and penalties for those responsible for air pollution, including those outside Thailand. Meanwhile, the Move Forward Party's version of the bill proposes rights to healthcare access and receiving alerts when PM2.5 rises above the safe threshold over 24 hours. It also introduces the development of an air pollution forecast and a database on the sources of air pollution, as well as revising the plans to tackle air pollution every year. The Democrat Party proposes that vulnerable people should be entitled to free health checkups at government hospitals. It also proposes that citizens should be involved in drafting a master plan to tackle air pollution, both at the local and national levels. While the Palang Pracharat Party proposes clean air officials who will have the authority to punish those who emit toxic pollutants. It also proposes that areas with high levels of PM2.5 should be declared hazardous zones. All bills insist that sources of air pollution outside Thailand will be held accountable if they are proved to be harmful to Thai people's health and Thailand's environment. So what has the Sethar government done so far with all these bills? Last Tuesday, the Cabinet endorsed the government's Clean Air Bill, which has gone through a public hearing process and has been vetted by the Council of State. This has frustrated the Move Forward and Democrat parties, who demanded that all 7 draft bills be considered, as they all aim to tackle PM2.5 pollution, even though some of the details vary. Prime Minister Sethar Thavisin has since approved the Move Forward Party's Clean Air Bill while he was in Chiang Mai province last Thursday and has sent it back to Parliament to be included on the agenda for debate.